If a Silicon Valley tech startup reached 55 countries and onboarded, over 20,000 specialized workers in less than 3
Oh,
years.
there would be documentaries about it.
Right. Wall Street would absolutely lose its mind.
Oh, yeah, completely.
You would see their CEO on literally every magazine cover. But the most staggering rapid scaling operation of the last few years, it didn't happen in a tech hub.
No, it didn't.
It happened on the front lines of global public health in Africa.
Yeah, it's a phenomenal trajectory. I mean, when we look at the traditional, often glacial pace of international development and, bureaucratic aid, what we are dissecting today defies almost every conventional expectation of how fast a health network can actually grow.
Welcome to today's deep dive. We are exploring the comprehensive humanitarian footprint of the Aniyom Foundation, or GAAP.
GAF, right?
And here's the kicker for you listening. They were officially established in May 2023.
That's why.
Let's let that sink in for a second. May 2023. Our mission today is to unpack exactly how GAF managed this massive continent-wide scale-up. We're going to look at their core operations, so immunization, WSH, which stands for water, sanitation, and hygiene, and emergency response.
And we are going to look way beyond just the surface level numbers today.
Yeah.
The goal isn't just to list off what they've accomplished, but to pull back the curtain on how their internal mechanisms actually work.
Right, the how is the interesting part.
Exactly. Their holistic system strengthening approach is really a masterclass in modern humanitarian strategy. Because they're not merely airdropping supplies to treat symptoms, they're engineering entirely new resilient health ecosystems from the ground up.
So before we get into the specific diseases they are battling, we really need to understand the architecture of this army they've built.
Yeah.
Their core mission is targeting the most vulnerable, hard-to-reach populations to prevent and respond to vaccine-preventable diseases, or VPDs.
Right.
And they are operating across all 55 African Union member states.
Which is huge. And that phrase, hard to reach, it's so common in global health that it almost loses its meaning.
Oh, totally. It just sounds like a buzzword.
Yeah, but think about the logistical nightmare of what that actually entails on the ground.
Right.
You're talking about remote villages with no paved roads, regions experiencing political instability, and communities that are completely off the grid. Reaching them requires an incredibly specialized footprint.
And their footprint is massive. I mean, they have specific focus areas in places like Nigeria, Kenya, Malawi, Senegal, Rwanda, Zambia, Tunisia, and Mauritania. But the number that I just cannot get past is the training of over 20,000 health workers.
It's a staggering number.
And these aren't just, general volunteers handing out flyers. We're talking about EPI or immunization officers, surveillance officers, risk communication and community engagement officers, and data officers.
And that extreme specialization, that is precisely the engine behind their scale. Well, let's take those risk communication and community engagement officers, for example, often abbreviated as RCCE.
Oh, okay.
If you're listening and wondering why a medical foundation needs a communication officer, think of them as the bridge between cold medical science and local human trust.
Oh, that makes sense.
Right. You can procure all the life-saving vaccines in the world, but if a local community is terrified or, suspicious of the intervention, those vaccines just sit expiring in glass vials.
Right. The medicine doesn't work if people won't take it.
Exactly. The RCCE officers do the crucial, invisible work of building trust before the needle ever even comes out.
Okay, I get the specialization, but honestly, this still sounds like a recipe for a logistical disaster.
How do you mean?
Well, if you hire and train 20,000 people across 55 sovereign nations in under 3 years, how is it not just total chaos? Like trying to build the tracks while the high-speed train is already running? How does an organization avoid collapsing under the sheer weight of its own rapid expansion?
What's fascinating here is the mechanism preventing that collapse. It's their decentralized empowerment model.
Decentralized.
Yeah, driven by two of their core values, producing results and collaboration. Notice I didn't say command and control.
Right.
They are running this entire operation from a single dictatorial office in one capital city.
So they aren't treating the continent like a charity case that needs top-down management. They're treating it like a decentralized network.
Exactly. When they talk about collaboration, it means they are actively empowering local individuals.
Right.
So by training a local resident in Senegal to be a surveillance officer or a local in Zambia to handle immunization logistics, they ensure that the expertise lives within the community.
Oh, wow. So if GAF has to shift resources to a new emergency in another country, the local village doesn't suddenly lose its health infrastructure.
Precisely. The knowledge stays. That hyper-local empowerment is how you scale rapidly without the whole system just falling apart.
Okay, so you've got this decentralized, highly specialized army, but what exactly are they fighting?
Right.
Which brings us to their primary battleground. Stopping outbreaks before they spiral into global pandemics.
Yeah.
They are running both preventive and reactive mass campaigns for communicable diseases. And we're talking about heavy hitters here: measles, yellow fever, meningitis, cholera, and COVID-19.
These are pathogens that ruthlessly exploit any systemic weakness.
Yeah.
I mean, cholera will immediately exploit a compromised water supply. Measles, which is incredibly contagious, will instantly find the gaps in your immunization coverage.
They're opportunistic.
Very opportunistic threats.
And GAF is executing these integrated campaigns in extremely high-stakes environments. They've got operations in Akwa Ibom, Sokoto, Yobe, and Abia State in Nigeria, plus integrated work in Lusaka, Zambia, and across Kenya. But, if you are listening to this and wondering how a single NGO manages this, here's where it gets really interesting. Because diseases don't respect borders.
No, they don't.
A mosquito carrying yellow fever isn't stopping at a passport control checkpoint, right? So how do they actually manage an outbreak when thousands of people are constantly moving across a porous border, like, say, the one between Niger and Nigeria?
That exact scenario, cross-border transmission, is the fatal flaw in most traditional state-by-state health initiatives.
Because everyone's doing their own thing.
Right. If Niger handles it one way and Nigeria handles it another, the virus easily slips through the cracks. This is where GAF shifts from being a medical provider to playing, honestly, three-dimensional geopolitical chess.
Wow.
They rely on cross-border synchronization.
Okay, I have to stop you there, because cross-border synchronization, that sounds like a diplomatic meeting, not a medical intervention.
It does sound like that, yeah.
I see in the source they implemented a 5-pillar strategy for these regions, and one of the pillars is legal and workforce frameworks. I'll be honest, when I think of stopping a deadly cholera outbreak, I think of antibiotics and IV fluids. I do not think of lawyers. How does a legal framework actually save lives on the ground?
It's a great question, because the legal framework is the invisible shield making the medicine possible.
Okay, walk me through that.
Let's look at the mechanism. Imagine a severe outbreak of a novel virus on that Niger-Nigeria border.
Okay.
The medical teams on the Nigerian side need to instantly know what the teams on the Niger side are seeing. But health data is highly protected.
Oh, right. Privacy laws.
Exactly. Without a pre-established legal framework governing cross-border data sharing, the doctors literally aren't allowed to share patient surveillance metrics.
Ah, so the red tape would effectively blind the doctors?
Precisely. They'd be flying
Yeah.
blind. Furthermore, without a legal workforce framework, you can't just send a specialized Nigerian epidemiologist across the border to help in Niger.
Because their license wouldn't be valid.
Exactly. Their medical license might not be recognized, or they might not have the legal right to work or quarantine patients over there.
That makes so much sense.
So, by establishing these legal frameworks ahead of time, GAF ensures that when the outbreak hits, the red tape is already cut. The personnel, the data, and the lab diagnostics can flow freely and instantly.
So they are gathering international stakeholders to do root cause analyses in these regions. And I see they ran regional preparedness workshops across all 5 African Union regions.
They did.
It sounds like they are forcing fragmented national health systems to finally talk to each other.
Yes, and they lock that communication in with key performance indicators, or KPIs.
Okay.
These are designed to support the continental immunization strategies. They aren't just saying, hey, let's work together.
Right. It's not just a handshake.
No, they are saying, here is the exact metric we are all going to track in real time to ensure the entire continent is moving in the same direction.
What?
It is brilliant macro-level logistics.
Well, we've seen how they handle the vaccines, the legal red tape, and the border logistics. But all that medical maneuvering is completely useless if the physical environment is actively making people sick.
Oh, absolutely.
You can't vaccinate a community against dirty water. Which brings us to their WASH initiatives: water, sanitation, and hygiene.
WASH is the absolute bedrock of any functional society.
Yeah.
Without it, you are trapped in a perpetual cycle of treating the same preventable diseases over and over again.
To me, trying to improve public health without adjusting wash is like trying to bail water out of a sinking boat without plugging the hole first. Or like installing $1 million security system on a house that doesn't have a roof.
That is the perfect way to visualize it. You have to fix the roof.
Right. The threat is pouring in from above.
And the scale of their wash interventions shows they are deeply committed to doing just that across communities, schools, and health centers.
And these aren't small projects. They are executing heavy engineering, borehole drilling, piped water supply systems, latrines, wastewater treatment. But they specifically use the term climate resilient water